At Hope Biosciences Research Foundation, we believe in science in service. That is, in judging the merit of clinical research by who and how it helps, both now and in the future. We believe one patient is a beginning and a strong enough foundation to support a body of research that can truly inform the way we approach healthcare.
Welcome to the Compassionate Use Program. In 1987, FDA formally developed rules for expanded access, otherwise known as compassionate use. It's a program that is exclusive for patients who would probably never qualify for a clinical trial due to age or severity of their condition. Many companies have a hard time participating in this sort of research because the time it takes to get a protocol approved for a single patient is often no different than engineering a trial for 80. One of the best examples of how compassionate use can make such a tremendous impact is in Parkinson's disease. Our very first Parkinson's patient was a 76-year-old woman who had been suffering for 14 years from Parkinson's, had debilitating symptoms. I mean, it was painful to even watch her just go about her daily life. She needed help. And so we stepped in, we created a protocol for her because there would be no clinical trial that she would ever qualify for. After successfully treating her, we were able to document a near complete reversal in her Parkinson's symptoms. This case led us to the development of our first clinical trial, and now we have over 6 protocols for Parkinson's disease, and all possible because of the very first compassionate use case. At Hope Biosciences Research Foundation, our history begins with expanded access, and it is by far the most important program that we have here today. In the last 4 years, we have received 25 FDA authorizations for compassionate use. Every innovation starts with the first patient. In this case, compassionate use, so many of these patients are N of ones, just a single data point. But we are building upon these individuals, and the body of data that we are collecting and putting together will amount to a greater impact in the future. Michael Lee suffered a terrible spinal cord injury, a complete obliteration of his spinal cord from a skiing accident. And while he was in the hospital, and while we were discussing the possibility of him becoming the very first compassionate use case for spinal cord injury, his doctors had reminded him that no matter what he did, he would never walk again. And I will always remember, he said, "That's okay. I'll be patient number 1." That is the very spirit of the Compassionate Use Program. Since Michael, we have done 3 other spinal cord injury cases, all under compassionate use, because rarely there is any commonality between spinal cord injuries. They're all very different and have different treatment protocols, but we're learning. And through this data, we are going to begin large protocols in spinal cord injury that will hopefully one day lead to a tremendous impact for patients everywhere.
At Hope, protocols are prioritized through a scoring system comprised of 13 factors, including but not limited to disease severity, rate of progression, pediatric status, and veteran status. Most recently, Hope Biosciences Research Foundation obtained FDA authorization and successfully treated Neil Vyas, a young man born healthy but living at the age of 13 with severe drug-resistant epilepsy, resultant of infection of unknown origin.
My name is Anuja Vyas, and I am an obstetrician and gynecologist at Houston Methodist Hospital.
My name is Udayan Vyas. I work in kind of innovation technology and emerging technologies.
Neil is 13 years old and my daughter is 11 years old. And when Neil was 7, he he got struck by some kind of an illness. We still don't know exactly what it was, but he was a healthy, perfectly normal, very neurotypical 7-year-old. It was like our entire life changed in the blink of an eye. You know, we thought, all right, it'll take maybe a year, maybe 2 years until he's ready to, or until this all goes away, right? We still had all this hope that it would all go away. But now we're on year 7 and it hasn't gone away. And we've tried 20 different medications and he's had multiple surgeries.
You know, the seizures are, you know, very scary every single time. You never get used to them. Like even as, like I've seen him seize probably 500 times.
Neil is sort of first in class, right? This is experimental. And the big thing is that if it does help Neil, it can actually open up a huge potential opportunity for other kids, because it's not just about him, it's about everyone who comes after him. So I am, of course, very hopeful that this is going to help him, because if it helps him, there are hundreds, thousands of kids like him that it could help.
When asked to elaborate on their favorite part of the Compassionate Use Program, the Hope team is resoundingly clear. Telling the family they've been granted authorization is a very special moment.
I love the positive impact we make on other people's families. When I get the email from FDA stating that we can proceed, I get really excited planning how to tell the family.
Nothing is more rewarding than when you get to tell the family.
Well, good. That's great news because guess what? The FDA approved your protocol for more treatments.
I have news for you. Nos dieron la aprobación para 24 infusiones más.
Muy bueno. Thank you.
So that's good to know, because we actually received FDA approval.
I gotta leave. I'm so sorry. Dressed all day long. Oh my god.
Well, we're so excited. We're so excited for you. We're so glad.
Thank you guys so much for everything that you've done. You don't know how much this means to us.
My name is Maria Francia. I am a mother of 4. At 3 years old, he told me, "Mom, I want to be a bull rider." He was always active. He was never still. He was always a hard worker, that's for sure. He was a hard worker. He knew how to weld. He can do, fix a fence, and he loved to be outside. Then he said, "Mom, I want to be an auctioneer." He became an auctioneer, and I have his hammer. It was all taken away in a second. Got the phone call that he was in an accident. I went there. He was only 10 minutes away. I was calling his phone and he didn't answer. Once I passed this bridge, I could see his truck on the side of the ditch. I got there and I ran.
The team has something to show you. Can you take a look at this?
Hi there, Maria. I'm Marcy from Hope Biosciences Research Foundation. Just wanted to thank you firstly for making the time to speak with us today. We wanted to let you know that we are so excited to inform you that the FDA has authorized treatment for Luis. Congratulations!
You. And I know Luis will be very happy. Oh my gosh, this is the best news. Thank you. From the bottom of my heart, thank you. I'm so grateful. Our prayers get answered. And I know they will be answered. That's what the name is all about, hope. This is what it is. Never lose your hope.